А чого немає двох? Тільки один екран. Тільки я, а презентація. Okay, so hello everybody. As I understand, at least 20-30 people are with us now. Do you hear me? Please somebody type that you hear me and everything is okay with picture, with presentation, with voice. Guys, do you hear me? Yes or not? So we have small pause between what I'm talking and what you hear. But let us start. I hope everything is okay. So today we will talk about fillers, about anatomy, about how to inject, where to inject, and what kind of injections are safe, and well, about everything, what is necessary to know to be successful and to inject in the right way and to earn money as a result. We will talk about fillers with the brand name PHILLEX. Why? Because thanks to this company, thanks to Yuma Medical, and thanks to the distributor in the Gulf countries, we have the ability to talk and to meet today, and I hope it will be useful for you. I am Turkevich, Professor of Dermatology, and I would like to share my knowledge today with you. So, let's go. What we have to know first about the fillers that we are using. As I know, especially in the Gulf countries, there are some people that are using not just HA but also different fillers. And I want to share my experience that the best what can be for injections, these are the fillers made from the hyaluronic acid. Why? First of all, because they are natural for us, because we all know that we have HA in our own body, we have a lot of HA in the skin. Second, because injecting HA, we are doing something good for our skin. We are injecting the substance that have the very important biological role. It's moisturizing, reconstructing, it's fibroblast activation. HA have antioxidant properties. And what is the main and what you have to know and to understand why HA? Because it's the most safe filler that can be. Because just for HA we have antidote, because everybody of us knows that we can inject in the vessel, we can inject too much, and we can have some problems. And having HLAs, we can solve that problem. That is point number one, to be safe in our injection, to be really safe. We have to inject just HA, and we have to choose the right products from HA, and PHILLEX is one of the most right products, and I will explain you why. But before the explanation, I want to turn back a little bit to the history of HA. So the HA was discovered approximately 100 years ago, but just in 1964 there was produced the first cross-link product from HA, and just in 1994, can you guys imagine, 26 years ago, just 26 years ago, the first filler was produced, the first filler from HA. And what we have from that time? Well, in 1998, just 22 years ago, the first filler was marketed. It was Restylane, it was biphase filler, and from that time a lot of things have been changed. There was the first generation of the fillers. After that there was the second generation, so-called 3D matrix filler, and after that the third generation appeared. What I mean third generation, this is the generation that we know it, like Juvederm, like Stillage, and one of them, one of the most modern, one of the most safe is the PHILLEX. It's 4D matrix cross-link filler with lidocaine. What does it mean? That it's safe, it's modern, we have lidocaine, and our injections are not so painful. And what we can do with this filler, as I have told you, that hyaluronic acid is the natural component of the extracellular matrix, and I can't even imagine that our tissues, our skin can be without HA. And but in our skin we have the natural HA. What means natural? It's non-cross-linked, it's non-stabilized, and one set of HA is turned over daily. And with the age, the quantity, the general quantity of HA goes down. And this is one of the reasons, not just this reason, also the reason is the loss of the collagen fibers, is the aging, it's antioxidants, in the bad influences such as suns, for example. In the Gulf countries, sun is one of the most dangerous influence on the skin. But also the loss of HA in the skin is one of the reasons of aging. And what does it mean? That we have to inject to our patient different products with HA, starting from the boosters and finishing with fillers, and especially fillers we're injecting not just to enlarge the quantity of HA, but also to work with volumes, to work with the visible signs of aging. And those visible signs of aging is the so-called ptosis, skin ptosis, is the loss of volumes, is the dark cycles under the eyes, is the changes of the lips. And about all this and how to restore this in the very safe way we will talk today, and I will share all my knowledges with you. So, as I have told, with the aging, the amount of HA in body decrease. From 19 to 47 years old, it decreases not so fast, but starting from 50 until 70, it's really decrease. And we all know this, and due to this, the injections of HA are very popular now. And here you can see the quantity of the injection is the global statistics per 1,000 of human in population, the global statistics of injections. And also you can see the statistics of different injections. What I mean, the number one around the world, these are the injections of the botulotoxin. You all know, yes, Botox, Vestibel, Dysport, Azalure, and others. On the second place, there are the injection of hyaluronic acid. And this is one of the most used and one of the most popular among the patient procedure. On the third place, well, it's on the third place, but you can see, comparing the numbers, yes, in thousand numbers of procedures, more than 3,000, and calcium hydroxyapatite is just 150. So it's not so popular, and it's we can understand why it's not so popular, because it's really dangerous to inject radius, calcium hydroxyapatite, because we have no antidote, and it's not so safe. And if we will inject and some problem will occur, we will have no antidote. Injecting hyaluronic acid, especially Felix, we are on the very safe side. We have the possibility to solve any problems that can occur. And on the last place is polylactic acid. Why? Because polylactic acid is a very special product just for the stimulation of the collagen, and even more. It's the old product, and now we have much better products for the collagen stimulation. For example, it's polydesoxyribonucleotides, and Yuma Medical in their portfolio have such product as TWACE. It's polydesoxyribonucleotide, PDRN, that can stimulate the collagen in the very right way and in the very natural way. But if you will decide, if you will want, this can be the topic of our next webinar, of our next meeting, how to influence on the skin quality, how to influence on the pigmentation, how to stimulate the collagen in the very right natural way. Not today. Today we are talking about the fillers, about the PHILLEX. So, as I have told, we have to use just temporary biodegradable fillers, and PHILLEX is one of the best biodegradable fillers from HA. It's not the best way to use so-called complex fillers. Why? Because those complex fillers, they are semi-permanent or permanent, and starting from the point of view that there are a lot of things that we can't do with permanent or semi-permanent fillers, and finishing that the problems, if they occur, they can be solved just with surgeons, and even more. What for to use semi-permanent or even permanent filler? A lady is coming to you to make lips, yes, or to make cheeks, or to make chin, and using fillers from HA, in our situation PHILLEX, yes, PHILLEX Sub-Q or PHILLEX Ultra Deep or PHILLEX Fine Line. We have the result for 1 year in average. And after that year, our patient, that lady, she will come back and she will inject once more. What does it mean? It means that she's happy from your work, she wants to prolong it, she is doing one more procedure, and you are earning money every time when she's coming. And if you will inject the permanent filler, she will come, and if everything is okay, you will not see her for next 5 or 10 years. Or you will see her in 1 or 2 months. It means that something is wrong. So, as for me, HA fillers, for example, PHILLEX, is the best what can be from every point of view. From the point of view of the patient safety and from the point of view of our business. So, what is next? As I have told you, there were a few generations of fillers, and PHILLEX is belonging to the most modern, to the newest generation, and it's the modern option, and everybody who are injecting or who are injected with PHILLEX, well, you know, filler, PHILLEX, they are satisfied, means both doctors and patients. What we have to consider with making choice, with how to choose the right filler. First of all, it have to be a long-lasting result. 1 year, this is the long-lasting result. Everybody are happy, patients are happy, doctors are happy, and in 1 year, your patients are coming back to you. We have to have natural look and to have the natural look, it means we have to use the right fillers and to know anatomy and to understand, to really understand what we are doing, why we are doing, and what is possible to do. And also knowing anatomy, this is the way how to use less filler means to spend less money. And to achieve the better result means to earn more money. Also, the way of injections have to be really simple, because if the way of injections is simple, it's very easy to repeat them after some time, means to repeat and to repeat and to repeat, and every time you will have the great result. Also, we have to have some range of the fillers to cover all the patient requirements. Yes, we can inject the same filler into the lips, into the chin, and into the cheek and into the temple area, but it's better to have one filler, for example, for chin and cheeks, the other filler for lips, and the other filler for the fine lines. And having the range of the fillers, we can consider all, we can cover all the patient requirements. And also, they have to be safe, means not to have adverse reactions, because we know that now on the market there are a lot of fillers. There are hundreds of fillers, and all the companies are marketing, yes, our fillers is the greatest, but there are some cases when we are injecting some unknown fillers, and in 1-2 months, some really big problems, immunological problems occur, and patient can have edema, patient can have redness, the patient can have some immunological problems, and we will spend a lot of time. From my evidence, from my practice, I know that it's necessary, sometimes it's necessary to spend 1 year to solve the immunological problems. We are also losing our reputation, we are losing a lot of money to solve this, so you have to use just the right products, that's just those products that are proven and that we have the evidence about them. And such products with really great range of quality and evidence are the products called PHILLEX. These are PHILLEX Sub-Q. It's the most, the products that we can inject most deep places. We can inject in the chin, we can inject in the cheeks, we can inject deeply in the temple area. What for? Because this product can give us great, stable, it's very important, stable volume. If you decide to inject not so deep, but not so deep, you can use PHILLEX ultra deep. You can inject them under the skin, and also you will have a long-lasting, great result in restoring the volumes. And if you decide to inject the fine lines, you can inject the third part, the third product from this line is PHILLEX Fine Line, and in the red box, yes? All those products, they are really safe, they are made from one of the best from the point of view of the quality hyaluronic acids produced by Shiseido Group, and these products are the property and they are produced by Yuma Medical. This is the company from Great Britain, and this is the company, and we understand, yes, that if company is from Great Britain, we can be sure that the quality of the products are really good. It's not they are not the Chinese products. And here you can see the quality ensures of the safety. This is the quantity, yes, of the proteins, that small yellow. This is the quantity of the proteins in the fillers PHILLEX. Also, you see the quantity of endotoxins and also the quantity of iron. So it means those quantities, they are much less that are even possible, and they are totally in the range that European Union Commission require for the good products, for the safe products. Also, what is the difference between the PHILLEX and the other products? This is the technology of the producing of the gel. This is the very special spherical structure, gel with a very special spherical structure, and this gel gives us really perfect homogeneous structure with the really perfect viscosity, plasticity, elasticity of the products. And it's very easy to inject, but after the injection, it gives us really stable and perfect volume. But even in this situation, if we need to biodegrade this product, for example, okay, starting from the moment that some problem occurs, and we inject into the vessel, and we need to dissolve immediately the product. We are injecting PHILLEX, and in a couple of minutes, the product will dissolve. Or other, maybe we all know that sometimes our patients are a little bit strange, yes? They never know what they want. And they come to us today and tell, okay, guy, I want such lips. Yes, you made those lips in 1 week. She comes back and tells, no, they are too big. I want to make them smaller. Injecting the small quantities of PHILLEX, you can make them smaller. Why? Because this product is very predictable. One more thing, we all know that the majority of the HA fillers, they have BDDE. For the cross-linking, and with PHILLEX we are sure that we have no free BDDE in the filler. The range, the level of free BDDE is so small that it can't be even tested, and it means that it's safe, because BDDE is not so safe for us, and it's safe just in the situation that it is connected with the chains of HA. It's safe when it's really connected from both sides. If it's not connected from one side, or if there is a free BDDE in the filler, it's not safe. With PHILLEX, you can be sure that the range of free BDDE is, well, it's absent. There is no free BDDE. And it means that we are using the safe product, and we will have no problems connected with the filler. Well, but not just having no problems with the fillers, but also not to having product with the type of injection connected with the doctor, with me for example. We have to understand anatomy, and we have to understand where to inject and how to inject. And we will talk today also about this. So let us see what we can talk today. First of all, if we want to inject, very carefully, we have to have the really comfortable syringe. Using doesn't matter, fine lips or deep plus or sub-Q plus, we have the same syringe, and this syringe is really very comfortable. This syringe allows us to inject 0.05, this is just 1 degree on the syringe, in the very special place, and to achieve the good result and to be on the safe side. Why I'm talking about 0.05? Because when you inject in chin or cheeks, yes, you can inject half of a syringe and everything is okay. But if you inject it in the infraorbital area or tear trough, you have to inject very small quantities. It's from 0.05 till 0.1 per injection. And to inject such small quantity and to inject exactly that quantity, not more, because if we will inject more, we can have, for example, a Tyndall here. To inject exactly that quantity, we have to have the very comfortable and precise syringe. And syringes of the PHILLEX, they are as comfortable as it have to be. So I have talked to you about the technology, yes, thixotropy, about the spheres, but why it's also important, it gives us the possibility to inject not just syringe, but also the gel in the syringe gives us the possibility to inject in the very right and comfortable way, and to inject that quantity that you need. What means that quantity? Here you see the table where we saw the extrusion force of different products, and you see that the extrusion force of the PHILLEX is like a line. We don't have the feelings that we have to inject and it goes down, back, but no, we are injecting, and it doesn't matter how much we are injecting, starting from 0.05 and finishing 1 cc, we can inject with the same force and the extrusion will be very right. And also we have to tell to our patient that injections will be comfortable. What means comfortable? That the level of pain will be as less as it can be. And due to the situations that in the PHILLEX we have lidocaine, the very small quantity of lidocaine, 0.3%. It's about nothing from the point of view of possible allergy. Even more, there are some studies that lido in fillers doesn't cause the allergy. It's not the drug lidocaine. It's not the remedy that is in ampoules, because in ampoules it's not just lidocaine, but there are also conservants, there are also some other things that are in the ampoule of the lidocaine, and they can cause some allergic reaction. Lido in the fillers is the pure lido that is put into the gel of HA, not by you, but on the plant. And it's really pure, it doesn't cause the allergic reaction. But this small quantity is enough that when you have been injected, and after that you are doing massage, and doing that massage, you allow lido to start to work, and they don't feel the pain. And even more, a couple of hours, means 1 hour, sometimes 2 hours, after the injections, they don't feel the pain that place. After that, they don't feel, because, okay, the trauma was not so big and they don't have to feel that pain. And it's very comfortable for the patient. So what is the idea? That injections with the PHILLEX, they are painless injection. And this is very important. So what we can tell about the PHILLEX is that it's biologically inert. There is no migration because of the very special formula of the filler inside. The result is long-lasting, 1 year, 12 months, but it's not permanent. The product have high plasticity and it's non-allergic. Means that product is safe, that using PHILLEX we are on the safe side, and this is very important for us. And here you can see some features of different fillers from the line of PHILLEX. It's about fine lips, deep plus and sub-Q plus. All of them have 24 milligrams per milliliter, and all of them have 1 cc, but the level of cross-linking is different, and that is why fine lips is the most fluid, most light filler, and sub-Q plus is the most strange filler, and we can inject it in the deep layers directly to the periosteum, restoring deep volumes. So what is next? These are studies comparing GAIs, this is the global scale of the what patients are feeling, using PHILLEX and other products, and you see that the level of the what patient feels and what patient think even after 1 year is much higher with PHILLEX. So once more, we have the big range, 3 different type of fillers. It's big enough to solve all the problems, but it's not so big as, you know, some companies have the range of 10 syringes, and you can even just remember, you can't remember which filler is for the solving of which problem, you know. Sometimes I'm thinking that there are companies that have one filler for the upper lip, the other filler for the lower lip, one filler for the right eye, the other filler for the left eye. It's for nothing. We have 3 different layers, yes, superficial layer, deep layer, and the very deep layer, supraperiosteal. And for those layers, we have 3 different syringes, and here you can see what can be solved with those different fine lips. It's starting from mimic wrinkles, crow feet, it's for the lip contour, it's for the small lines. Next, ultra deep is for the mid-deep wrinkles, it's for the nasolabial folds. It can be used for the nose correction. It can be and should be used for the lip augmentation. And sub-Q, it's for the cheekbones, for the chin, for the temple area. But it also can be used for lips. And if, for example, if you have the patient that want the very natural result and she's agreed, for example, for 8 months, you are using PHILLEX Deep. If you have the patients that tell you, doctor, I don't care how much I have to pay, but I need the result in the lips for 1 year, not less than 1 year. You are using for the lip sub-Q, she will pay more. And you will have the result for 1 year. What does it mean? That she is agreed for the less period, but she wants to pay less. You are using Deep. She is agreed to pay more, but she asks you for at least 1 year. You are using sub-Q. Or even more, she is doing for the first time lips, and she want just to try. Yes, you are using fine lips. You will have results for 5-6 months. Everybody happy. She has tried, and when she is happy after that, you are moving from fine lips, you are moving to deep, and you will have the longer result. So, what we have to talk next? As I have explained you right now, this is the there are different sides of safety. We have just talked about the side connected with the fillers, with the products. And I have tried to explain you that PHILLEX is one of the most safe products on the market. But there is the other side of the safety. And the name of this side is anatomy, knowing of anatomy. And injecting in the right way is impossible if you don't know and don't use your knowledge and don't understand the anatomy and the principles of aging. Why the aging is going, what changed in the face, and what is necessary to restore, to move everything back. and to make her younger and to make her more pretty, more beautiful. And let us talk about this. First of all, aging is connected with the bone resorption. What means bone resorption? It doesn't mean that in the age of 70, face start to be twice less. No. But the resorption, the very special part of the face, this is the angle of mandibula, this is the chin, this is the orbital, and resorption, even small resorption of these areas cause the big changes of the face. And due to that resorption, and even more, due to the resorption of the neck, yes, head goes down, and this second chin appears, and the bulldogs appears. Due to that resorption, we saw something that is called like skin ptosis. It's not the ptosis of the skin. This is the changes of the bone. And just understanding this, if we understand what is the reason, that not due to the big changes of the elasticity of the skin, no, due to the changes in the bones, all this appears. And if we are trying to restore, we have to restore the bone. For example, here, the margin of the mandibula or the margin of orbita, restoring them, restoring their volume, we are restoring the visibility of the face. And here is the table where you can see the physical appearance and the reason of the appearance. And you see that the majority of them are due to the changes of the position of the fat pads. And why the changes occur? Because the bone resorb, fat pad moves down, and what we see? The ptosis of the tissues of the face. And here you can see how it works. That resorption of the bone gives us the moving of the fat tissues, and also the fat pads also change with the age. Some of them, the majority of them, resorb and we lose some fat, and just some of them don't change their volume or even start to be bigger. But you know what is the worst? That those that we need, for example, mid-face fat pad or temporal fat pad or lateral fat pad, they resorb, and we need to restore that volume. And those that we don't need, for example, nasolabial fat pad, it can even enlarge with the age. Okay, this is life, but we have to do something to improve this. So here is the picture of the main fat pads, and even central forehead fat pad also can resorb. And with age we can see the hole here, and it's necessary to inject in the center of the forehead and to restore that fat pad. The same with infraorbital fat pads. Sometimes we have the, but don't make this. Don't make the mistake. Sometimes we have hernia. This is not the fat pad. This is, well, this is not the superficial fat pad. This is fat pad from under the eye, and due to the appearance of the hernia, we have such big pads with the fat. And this is the work of surgeons to remove that hernia. But sometimes we have dark cycles and loss of volume under the eyes. And this can be solved with the injection of the fillers, of the right fillers. In our situation, with the injection of the fillers from the range of PHILLEX. What also we have to understand, these are the dangerous zones with the vessels and the nerves. As I'm always talking, there is no safe places. If you have been injected patient and you have no hematoma, this means just one. You was lucky. But you was lucky just that moment. Because next injection can be connected with hematoma. And it's not dangerous, okay? If we are injecting, hematoma can be. But knowing the anatomy, the risk that you will inject in the big vessel goes down. The risk is reduced. The same is with nerves. That knowing where they are going, we reduce the risk of the injury of the nerves. So once more, let us analyze. The upper face superficial fat pad compartment, you see there is central forehead, there is supraorbital fat compartment, there is middle forehead fat compartment, lateral forehead orbital fat compartment, and lateral temporal cheek compartment. Why I was talking about all this, I will move back, because if we want to remove the signs of aging, we have to analyze what exactly fat compartment have lost the volume and to inject fillers into them and to restore that volume. But injecting this, we have to remember about the face risk zone in the upper part. So in the upper part, what we have? The very special risk zone. It's arteria supratrochlearis, it's arteria supraorbitalis, it's arteria infraorbitalis, it's on the border of the upper and middle part, it's arteria temporalis superficialis, temporal superficial artery, and it's deep temporal artery. And even more, every set patient, every set, it is possible that temporal superficial artery is connected with artery, supratrochlear artery. So it goes like here, and injecting even lateral part of the forehead, you have to remember this. And what does it mean? It doesn't mean, it does not mean that you have not to inject. It means that you have noticed, and every injection, especially injecting this dangerous zone, you have to make the aspiration probe. And when I will show you the demo how to inject, you will see what does mean the right aspiration probe. Because the right aspiration probe, this is the probe when you are going back at least for 0.1 cc, and you are doing it at least 10 seconds. Okay, if it's positive on the 5th second, you can stop. But if it's negative, you have to wait at least till 10 seconds. Aspiration probe for 1 to 2 seconds is for nothing. So, this is what I have told you about the vessels, yes. Next is temporal area. It's starting from the temporal crest and it's covered, forehead and temporal areas are covered by fat pads, but there is, as I have told you, there are a lot of vessels there. And about the temporal area, what are the anatomical risks? The first anatomical risk is temporal artery that is going here, superficial temporal artery. Making superficial injections, even making with such safe products as PHILLEX, we have to be on the safe side, means you have to inject very carefully. You have to make aspiration probe with needle, or you have to use cannula with big diameter, because using cannula with small diameter is not, it's as same danger as needle. Even more, when you are injecting, the most safe way of injection is perpendicular to the tissues. Doesn't matter, here it's perpendicular, here this is the way of perpendicularity, here is such way. Why? Because when you're injecting perpendicular, you can inject through the vessel. So you will inject one wall, after that you will inject through the other wall, and you will put the filler. Injecting more parallel injection to the skin you are doing, more risks of injecting into the vessel are growing. Also, deep injection, so-called shotgun, you know, like boom. Shotgun is also dangerous injection because on the bone, temporal bone, we have deep temporal artery. In the temporal fossa, we have deep temporal artery. And when you inject deeply, and you can do this just with a needle, you have to make for a careful aspiration probe. You have to make it to be sure that you're on the safe side, and after that you can start to inject, to push the filler. Here you see the pictures how temporal artery is going. And here you see the kind of the injection with cannula and with needle, and this is so once more. And here are the points where to inject. If we are trying to restore the temporal area, we have to go down from the temporal crest. We have to go down at least 2 centimeters, but not more. 2 are enough. Yes, to the center of temporal area. Go down from temporal crest to inject deeply. The depthness of injection in that situation will be around 1 centimeter, and the length of the needle is 1.3 centimeters, 13 millimeters, and you are on the bone. You are doing in aspiration probe. After that you inject, but if you will go not less and not more than 2 centimeters, from my on my opinion, 0.3 is enough to restore the volume of the temporal area. And how it looks after the injection, here you see the filler on the bone, on the temporal bone after the deep injection. So eyebrow, where we can inject, how we have to inject, and what are the ideas of those injections, and what are the dangers of the injection. We can do 3 injections, but during the injection number 3, we have to remember about supratrochlear artery, yes? And to do aspiration probe, to inject very deeply, to restore the volume. Injecting the middle part, if you want to inject, you have to remember about supraorbital artery. And you can find it, there is the small fissura here on the bone. This is the place where supraorbital artery is starting. And the most lateral part is the most safe part, because here there is no big arteries, and the possibility of making injury injecting into the artery is very small. And even more, sometimes this injection is very important. If we have the ptosis of the brow tail, we are injecting and we are moving brow tail up. Well, as I have told, where to inject, but you have to be very careful, especially with the injection number 2 and 3. Or you can use cannula to volumize wall the eyebrow, and to move it up, and to to reduce the science of aging, but all that injections have to be on the supraperiosteum level. You have not to inject superficial, but you inject to the bone. And in that situation, the risk of the injection starts to be much lower. So, orbital resorption. When we are talking about orbital, we have two things connected with the aging. One is the orbital resorption, and the other one is connected with muscles. Because with the age, the contracture of the muscles start to be bigger and bigger and bigger. And the quantity of wrinkles start to be bigger and bigger and bigger. Why? Because we have the contracture of the orbicularis oculi muscle connected with the skin. So to remove the signs of aging of the periorbital area, it's necessary to combine the buttocks and the fillers, buttocks to restore the muscle, and Felix, filler called Felix, to restore the orbital resorption. Two main things that can be as a signs of the aging of the orbital area, I mean infraorbital. These are dark cycles that appears due to the loss of the fat volume under the eye, and this is tear trough that appears due to the moving of the mid-face fat pads. And even more, when we are injecting, for example, when we are injecting to restore the dark cycles and to make the tear trough less visible, we can inject 3 dots under the eye. We have to inject on the marginal board of the orbita, 1 millimeter below. What you have to do? You have to move at least 2-3 millimeters from the internal part of the eye laterally. From the medial canthus, you have to move 3 millimeters medially. From the lateral canthus, you have to move 3 millimeters medially. And you have to go 1 millimeter lower than the marginal orbit rim, but not more than 1 millimeter. And this area, it's really safe because it's free of vessels. Because in this area, we have just vessels in the skin, small capillaries. When you inject in, you can have the hematomas, but you will never inject in there. You will never inject in the big vessels. You have never inject in the main arteries of veins, and mid part of the face, and injecting upper part and infraorbital part. You can use, the best is to use PHILLEX ultra deep, just for the deep injections of the temporal area. It's better to use subcutaneous. Well, mid part of the face. mid-face superficial fat compartments. You see on this slide all the compartments that are, but the mains are mid-face fat compartment and lateral nasolabial. Why? Because the changes in that fat compartments gives the most visible age changes, and restoring them, we will restore the face of the patient in the best way. Restoring them, we are doing the best what we can do for our patient. But we have to remember about the reasons. Once more, what are the reasons? The first and the main reason is arteria facialis. It goes from here, near the lips, near the corner of the lips, near the nasolabial, and after that it moves to arteria angularis, goes near the nose, and after that arteria angularis is going to arteria ophthalmica and finish in the eye. And if you will inject arteria facialis, there is a risk of blindness. This is the most dangerous risk. Also, there is the risk of ischemia. And you have to be very careful. Injecting in this area, you have always make the aspiration probe. You have to inject very deeply because that artery is going under the skin. And if you will inject deeply to the bone, you will reduce the risk of the injury of the artery, of the injecting into the artery. You have to make the aspiration probe, and you have to remember where is it. Also, mid-face, it's nose, and nose, the vascularity of the nose is not so big, and just from the angular artery, it's going arteria nasalis. Also, we have some vascularity from the forehead side, and we have from the side of the lip, arteria columelaris. So you have to be very careful injecting the noses, not to inject too much. Also making aspiration probe, injecting deeply to the bone or to the cartilage, and nose, it's for advanced injectors. Never inject nose if you are not advanced injector. So here you see, as I have told you, angular artery. Next is infraorbital artery. Infraorbital artery is going in the fossa canina, starting from the infraorbital hole, and there is the risk of the injury in the infraorbital artery when you inject in central mid-face part. So injecting this, you have to find where it is, you have to press, and when the patient will tell you that he feel the pain, it means that you press infraorbital nerve. And infraorbital artery is very close to infraorbital nerve. And you will move from this point, for example, 1 centimeter laterally, you move, and you can inject the needle. After that, doesn't matter that you have find where it is, but you have make the aspiration probe, and after that you can inject. And never inject too much. For the mid-face, for the central mid-face, it's enough to inject 0.3. If you are injecting the right weight, you will put the bolus 0.3, it's enough to restore the volume, the visibility of the volume, yes, the visibility of the volume in the face, to restore it and to be on the safe side. These are the possible ways of the correction of the zygomatico-temporal zone using dermal fillers. You can make such picture on the face, yes, and find what place is necessary to restore, find where is the depression, and to inject in that place. It looks like here. You can inject with needle or with cannula. Well, as for me, I prefer to inject with needle. You know why? Because, frankly speaking, cannula is not 100% safe. Even more, I have in some presentation, I have the tables where I compare the diameter of the cannula and diameter of the vessel. Just cannula 10 gauge is really safe. But this is not our cannula. This is the surgical cannula. Even cannula 16 gauge is not so safe for some parts. For example, for arteria facialis, it's not safe because it's thinner than arteria facialis. Facial artery is more thick than cannula 16 gauge. And I'm not even talking about 21 or 30. So I prefer needle because with needle, I'm always afraid. With needle, I always, I know where I'm exactly. I have the possibility to do aspiration probe. With cannula, I have no possibility to do the aspiration probe. And I always understand that I'm in the risky zone. And I have to be very careful. With cannula, people sometimes they think, oh yes, it's okay, I'm still on the safe side. They are not on the safe side. And this is the way to make the mistake. So, what is next? Here are the ways how to inject with cannula, with 5 dots technique, with cannula technique, with 3-point technique for lifting. But you know what is main? The main is not to use some technique. The main is to understand the anatomy, to see the face like an artist, to see what is necessary to restore, to inject in the very special, in the very right place, not big quantities of the very right and safe filler. And as for me, PHILLEX, well, the range of the PHILLEX is one of the most safe brands on the market. Lower face area. Well, if we are talking about lower face, we have to analyze not just emphase but also profile. We have to analyze from the wall sides, and you know it's really very important because if we have the deficiency of the chin, for example, I will try to explain you. You know, if you are talking about the male faces, and can you imagine male without chin? Yes, there are some males and females also without chin, and it looks terrible. He will never, male without chin will never look like macho. He will never look like alpha. He looks like guy without chin, and it looks sad. The real man have to have the right chin, the big, the prominent, sexual. It have to be right. What's it called in ladies? The type of chin have to be different. It have to be small, but it have to be also prominent. It have to be, at least to be. And if there is no chin, like, it does not look sexy. And chin is really very important thing. Chin is really very important. It's even much more important than lips. And not just chin, also the length of the chin plays the very important role in the comparison of the upper, middle and lower part of the face. And we can enlarge chin and make the face more harmonious. But injecting lower part, and the same as with mandibular angles, injecting lower part, restoring or building chin, or restoring mandibular line, and restoring angles of the mandibular, we have to remember also about the dangerous zone. The most dangerous zone of the lower part, it's facial artery, because here facial artery starts. It starts from the arteria carotidis, but here it goes on the face. And when you inject in here, the best is to use the big range cannula. Well, no, the best is to know and understand anatomy. And after that, if you are restoring the wall mandibula, is to use the big range cannula, at least 16. And in that situation, it can be on the safe side. Restoring the chin, it's great and it's okay to use needle. One more thing, what I have told you, yes, about the facial artery. Also, there is the mental nerve, but the possibility to make the injury of mental nerve is much lower, especially using a needle. So, what you have also to understand, I have told you, yes, small quantity, 0.05 or 0.1 here, 0.1 here, not more than 0.3 here. But when we are talking about chin, forget it. Forget everything what I have told you before about quantities. You have to remember one thing. When you are injecting chin and you think that 0.2, 0.3 is enough, better not to inject. Because if you need to inject here just 0.2, 0.3, it means that this chin you don't need to inject. But if you need to restore the chin, if you need to make it as it should be, from one syringe. It just starts from one syringe. There are even patients that needs 2 syringes. And for chin, the best is PHILLEX sub-Q plus. And when you inject that one syringe, you know, there are some patients that, especially male patients, but also female, there are some patients that it is enough just to do one injection. Can you imagine this? One syringe. Well, I was traveling around the world. I know how much cost in different countries fillers. In Gulf countries, one syringe costs around $500. Yes, I mean the injection of the syringe, not syringe, but the syringe with the word. Can you imagine? You can do just one injection in the central part of the chin. They inject one syringe from the first injection to inject all the syringe, to rebuild the chin, to change totally the face, and to end 500 with one injection. It's necessary just a couple of things. To see the face, to calculate, to understand that yes, in this phase the chin is the most important. To know how to inject, that is why I'm talking to you, just one injection in the central part. And to use the right filler, PHILLEX sub-Q. And one injection, 500. As for me, it's great. Well, and here are the ways how to inject and where to inject and why to inject. It's bite and lips, because lower part, it's not just chin, it's also lips. And let us talk about chin and lips. Here we saw so-called Steiner line, because there is also I have forgotten the name. There is the line that we put from the chin to the tip of the nose, and it's not so important. But the Steiner line from the subnasale to the chin is very important. We can analyze the chin, we can analyze the lips, and we can analyze what is necessary. This line is Ricketts line, from nose to the chin, yes? And this is from subnasale to the chin, it's Steiner line. It's much more important. We can analyze if we need or not to enlarge the chin, if we can analyze if we need or not, is it possible to enlarge the lips, we can analyze the profile of the face. And it's very important to analyze and to restore the profile of the face. And here are the situation, what is necessary to do and how it's possible to improve with Felix. As I've told, for the lower part, the best choice is Felix Sub-Q Plus. And we can inject and restore. So, as I have told, Sub-Q Plus, the main injection for Sub-Q Plus is the chin and cheek restoration and also temporal area. Here you see the possible ways of injection, but as I have told you, in my opinion, chin can be injected with one injection. If you are talking about the mandibular correction, you can inject with cannula. And here we saw the results of the profiloplasty with the chin correction and results. And you see before after. As for me, it's even necessary to inject more, but even after the first injection, it looks better. And this is also possible ways of correction with cannula. I'm telling to you what the ways of correction are in general, yes? This way of injection, or for example, such way of injection. But as I have told, as for me, I prefer to inject with needle, one or two place of injection. For ladies, it's one. For men, you can inject once, but you can move with a needle to inject one part, half of a syringe right side, half of a syringe left side. Because if male have the chin like this, and it's okay for male to have the chin from two parts. It looks nice. Ladies like this. And when we are doing correction, we have not to change, we have just to restore. If we are changing, it means that our patient haven't something. Yes, in that situation, if patient have no chin, we necessary to change. And if it's possible, when you are building, not rebuilding, but building the male chin, if it's possible to do it like from two parts, it will be really great. But if it's possible, sometimes it's possible, so just do the big square chin, and your patient will start to look much more masculinized, and he will be happy. And here you can see the possibility of the change of the mandibular line and mandibular angle. Changing the mandibular line, you have to remember about the wrist zones. Even with the angle, you have to remember that there is the saline glands, and there is the masseter here, and we have to take into account injecting, because if you will inject into the masseter, there will be no result. So here you see where it's necessary to inject and how to inject. But be careful on the fascial artery. And the last but not least, this is the lips correction. So this is how lips look like and what anatomical structure are. These are the Felix deep that can be used for the correction. As I told you, Felix Deep is one of the best for the correction of the lips, but also if you're advanced injector, you can use Felix Sub-Q. And also if your patient is injecting the first time, you can use Felix Fine Lips, but Felix Deep is it's number one for the correction of the lips. It have the great elasticity and and it's very important because when and here it have really great cohesivity and viscosity. Why it's important? Because when we inject in lips, we have to understand that our patient is using and moving, yes, moving like moving lips all the time. And it's necessary for us to do everything that he, the majority she, yes, have to feel herself very comfortable and natural with lips. And that is why we have to use the gel with the really great elasticity, viscosity, plasticity and cohesivity, not to inject too much, to have the perfect injection control. And you see the difference between injection control of the Felix and competitive products. And you are waiting now, yes, that I will tell you how to inject the lips. You know, I know at least 15 different techniques of injection. And all of them are bullshit. They are for nothing. When you inject in lips, it's enough to inject with needle, just leaving small bolus of the good product with good features like Felix Deep to make the massage after. Because, believe me, you can't change the form of the lips. This is like storytelling. You can't change it. You can make them bigger, more filled, yes. You can make them bigger in some part and don't touch the other part. But all the stories that you can make Angelina Jolie lips, like other movie stars, this is total bullshit. It's impossible. We can just change the volume of the lips. Yes, we can change the volume of the whole lips, or change just part of the lips, or just one lip. But it's impossible to change the form of the lips that we have from the burn. So don't tell the patients that you will make them the other form of the lip. You can, if you will inject 3 syringes, yes, you can radically change the form of the lips. In every other case, you can't change the form, you can just improve it a little bit. So be honest with your patient. You have to analyze where the lips have no enough volume to inject small bolus, 0.1 per injection, and to make the massage. What you can do, you can change the prominency of the lip. If you will inject very deep to the submucosa and put fillers there, you can move the upper lip ahead, but not too much. What else you can do? What else you have to remember? When you are injecting lips, hematoma can be 10 times faster than in the other places, in the other areas of the face. So, if you are injecting lips and there is no hematoma, you are just very lucky, but you are just very lucky in this very special injection, because the next one, hematoma can be. Never tell to the patient that there will be no hematoma. Just shut up inject lips, and if there will be no hematoma, tell them, oh, you see how great I am that there is no hematoma, but relax. In 90% of the cases you will have hematomas, and it's not dangerous. What is the good news? That the risk of ischemia in the lips, if you're injecting just one syringe per lips, if you're injecting 3 syringes, it's the other story. Risk of ischemia is very small because the vascularity, the quantity of the vessels in the lips is so big that the risk of ischemia is really very small. But you have to be careful because doesn't matter it's small, it is. And what else? This is all the possible measurements of the lips, all the possible forms of the Cupid's bow, of the philtrums, the shape of the lips, anthropometry of the lips, closed lips lines. We know a lot about lips, we know a lot of things about lips. As I have told you, there is a lot of ways of the possible corrections, but there is just one way of the augmentation of the lips. And if you will make the right augmentation of the lips, they will be nice. If you will decide to change the form, nothing good will be after that. So now I will show you some example of the full face correction with the PHILLEX, with the range of the PHILLEX, PHILLEX Sub-Q Plus, PHILLEX Deep Plus, and PHILLEX Fine Lips with the whole range, because this is the best options for the natural and long-lasting result. And let us see what can be. So, this is our patient Natalie, and today we will make everything to make her more beautiful. She's pretty enough, but I will use my technique. It's 17 dots, code of beauty. We will inject her forehead, we will inject mid part to remove the nasolabial folds and to move up the cheeks. We will make the face more oval because she have now square face. We will make more oval. And how we will do this? We will work with chin, and we will also restore a little bit her profile. And we will use Felix. This is the first monophasic filler with a spherical molecule. As I told, for the small wrinkles it's fine lips. For the more prominent deficiencies, Deep Plus. And for the periostal injection, it's Sub-Q Plus. So, we are preparing, you see how to open the syringe, not to move, but just to turn to the side. After that, to put the needle, needle is 30 gauge. Aspiration probe, look. You see at least 0.1 and waiting. After that, there is no blood in the syringe, so we can inject. It was Felix Fine Lips. It's very plastic and very elastic, so now we have the bolus, but we are doing light massage, and you see there is no even signs of injection, no boluses, but just the restoring of the volumes. So after that is the superficial and deep injections of the temporal area. We use PHILLEX D plus and a lateral part of the forehead, PHILLEX D plus. 0.1 per injection, also aspiration probe, and after that injection, bolus and massage. So infraorbital and skull bone area. As I told you, we can use 3 dots intraorbitally and 3 dots in the skull bone area, 0.1. Next one, the first one was most lateral, second one is OG line. And the last point, the last dot is the point near the infraorbital artery. You see I have press, I feel the pain. It goes a little bit laterally and inject. And we are doing light massage, and our movements here just massage, and on the lateral part we have to move laterally and massage. You see there is no bleeding, no edema, no hematomas, because these techniques give the possibility to give the very natural result. You see how square is her face now. From the close look we see all the irregularities of the lower part. So we are using PHILLEX sub-Q plus and changing her chin and changing the angles of the mandibular. Wall injections were deep superficial, supraperiosteal, not superficial, and also massage. All the injections were made due to the code of beauty, 17 dots, some dots of that code of beauty. And we and here you saw before after, and you can see that we don't change her too much, but she starts to look much more fresh, much more pretty, and she starts to look better. Also, I want to tell you that there is the association, the Facebook group, Secret Doctors Only. It's over 5,500 members now there. And it's just doctors, and we solve every problems. We can help, we can solve. If you will have some problems, and if you are the member of the group, you can put the photo, and in a couple of minutes somebody will help you. And here are my contacts: WhatsApp, Viber, email, Line, Telegram, WeChat, well, everything is there. My mail, Facebook Messenger, Instagram. If you have some question, if you need some help, you can always ask me, and I will try to help you. And what else? And now we will check some questions, yes, what we have or what we haven't. So we have some questions or not? Thank you, Fatma. Ten звук попадал, друзья. So if you have any questions, I'm waiting for your questions, and I'll be happy to answer. I will be happy to help you. And I'm waiting for your questions. Best technique to avoid injury to the marginal mandibular branch of facial nerve during session of jawline augmentation by fillers. No, it's not questions. How many syringes you use for this patient? For this patient, you know, as I understand, it was video, it was not live injection. I don't remember, but it seems to me that I have been used 3 or 4 syringes. Well, not more than 4 for sure, but if I'm not, I'm afraid to be a mistake, but it seems to me that 3, not more than 4. For the full face, for lips, for chin, for cheeks, for temple area, for forehead, yes, 4 syringes. Some other questions? Oh, sorry, Gülçin, Günür, Ulçum. I don't understand Turkish, so please translate into English. Which technique do you prefer for lips anesthesia? Look, if I will be sometime in the Gulf, in where you're from in Kuwait or in Emirates or in Iraq, I will show you how it is possible to inject lips without any anesthesia. How it is possible to do this without anesthesia. And you will understand that this is possible, and I will teach you how to do this. So, do you consider it's possible to administer hyaluronic acid to patient after the removal of permanent filler? Well, honestly, I don't believe that it's possible to remove permanent fillers if we are talking about not about silicone, not about biopolymer, but about polymethyl methacrylate. I don't believe it's possible to remove them totally. And if you have if you are not sure that you remove them totally, it's better not to inject. Some more questions? Guys, thanks to all of you that you have been there, that you were listening, that you spend your time, and I hope to see you all live that what happened around the world, that it will finish, and that sometimes we will meet live, and I can share my knowledges and my practical knowledges how to inject with you live. This will be the best, but we have what we have, and you understand that now there are hard times, there are hot times, and we have to be careful, and that's why we have the possibility to talk one with the other through the internet. Hopefully the modern techniques, and thanks to the Yuma Medical and to the local distributors in your countries, it was possible to arrange that this webinar and this workshop. I'd like to ask about the trade name SubQ Reflect subcutaneous, well injected deep in other slide, deep injections. No. SubQ, trade name of SubQ is PHILLEX, The name of that filler is PHILLEX sub-Q plus, and I'm injecting it always just deeply. Maybe it looks like it was subcutaneous. It was not subcutaneous. It was supraperiosteal. Sub-Q plus, I'm injecting just supraperiosteal. It's forbidden to inject such fillers superficially. Some other questions? When we can inject hyaluronic acid fillers to patients who has previously got fat injection? Well, what's it called in fat injections? You can inject in that moment that you feel it's necessary to inject, because fat injections it's not connected with HA, and if everything finished in the right way of fat injection, you can inject HA, but as I have told, as for me, one of the best filler, I'm not telling that this is the best one, no, okay, but one of the best fillers for the injection of HA is PHILLEX. It's PHILLEX Fine Lips, it's PHILLEX Deep Plus, and it's PHILLEX Sub-Q Plus. And I like them. I prefer to inject them. They are one of my favorites, and they can be injected after the fat injection. Well, not immediately, because after fat injection you have to wait until everything will be okay, until part of the fat will dissolve, and until everything will be okay. But exactly after that you can inject. So, if there is no questions, I would like to tell you thank you. I would like to tell you that I hope that you will start to there are to correct nose. Thank you, Marwa, for the nose. I prefer to use sub-Q. Why? Because I'm advanced, and if you feel yourself as advanced, you can use sub-Q. If not so advanced, you can use Deep Plus. The difference is just in the length of the duration, and well, it's, you know, sub-Q is for the more advanced injectors, but in the result there will be no difference. I prefer to use or sub-Q or Deep Plus. Sub-Q Plus or Deep Plus. Never Fine Lips, because it's too smooth for the nose. And that's okay. Even I will tell you more, I prefer to use needle with the nose, to use sub-Q with needle, and when I will have the chance to see you all live, I will show you how to do it in the safe way with a needle. And you will see it's possible. And it's possible to make fantastic noses with a needle, and everything is good and safe. Even more, I don't know, will it be or not? It depends on your distributor, on your local distributor, but if he will decide next week, we can have the webinar on the injecting of the TWAC twice for the collagen stimulation and for the skin recovery and restoring. It depends how your distributor will decide and how you will decide. So, Alina sir, can we inject fine lips on the eye to correct eye gear? Great question, Ali. Yes, we can inject, but I prefer to inject under the eyes for deep injection. I prefer to inject deep plus or sub-Q plus. You know why? Because when you are injected to the bone, you need to inject the strong fillers. If you prefer to inject superficially under the skin, it's really the great idea to inject fine lips. So it depends what is the level of your injection. If you're injecting under the skin, you're injecting fine lips. If you're injecting to the bone, sub-Q or deep plus. But you all see from our discussion, you see that there's this range of fillers, PHILLEX sub-Q plus, PHILLEX deep plus, and PHILLEX fine lips, gives us the possibility to solve any problem, to solve any question using one of those 3 syringes. So, okay guys, thank you everybody. I'm waiting if there will be one more question or not. If there will be no question, thanks to all of you. I hope to see you all. I hope to see you. I saw that there are also guys from Turkey there. Yes, I hope to see you in your countries. And also I hope that maybe we will see each other in 1 week, next week, with the webinar on twice, if you will decide that it's necessary for you. What should be the cannula gauge according to the application area? Well, it's the same under the eyes. Look, according to the principle of safety, cannula gauge should be not less, I mean not thinner than 21. If you will find cannula 18 or 16, it's much safer. And what's according under the eyes? No, I prefer to inject needle, because with cannula you will never achieve that result that you can achieve with needle in the area under the eyes, because it's very delicate area. It's necessary to do very precious injections, very precious. But it's great all this, but it's necessary to do it live, to show all the techniques, to do it live. As I have told, I'm sure that everything this will finish in 1 month, all that bullshit, and we will find the chance to see each other live. And now, I'm happy that all of you were there. I'm happy to tell you, to all of you, thanks. And I'm sure that we will meet in the web and live in the nearest future. Goodbye.